LuAnn Reese has had more than her share of struggles over the years. She has depression, which she first experienced as a child and adolescent. At age 35, she was diagnosed with bipolar disorder, and she has also raised a son diagnosed with both mental illness and developmental disabilities.
Well, and when I talk about my journey, I really talk about my experience with mental health and mental illness, but I also can't take out the piece related to my son who also has mental health issues and developmental disabilities, because we're intertwined. You know, we live together, we breathe together.
But none of these challenges has stopped LuAnn from improving life for herself and her son, as well as working to reach out and impact the lives of hundreds of families and youth. Her message is very clear.
We can do this with support of each other. They can do this. They can set goals. They probably understanding that we're all going to struggle from time to time, but that we can bounce back, and that we can also be a voice in helping promote a system that better meets the needs.
She considers the growing independence of her son Spencer as one of her greatest accomplishments.
But he now has his own apartment, and he's in a program with DD that is called Self-Directed Services. With this program, he's been in it about 4 years. He has not had a hospitalization since then. Within 6 months, he was no longer needing intense behavior support. He needed monitoring and encouragement, but related to outburst, it just almost went away. But he likes being in the community, and with individual supports and staff that meet his needs, and it's about him, they can have him in the community.
LuAnn has been involved in numerous statewide and national programs and initiatives. Friends and coworkers say her energy level and devotion to her job is endless.
I think LuAnn's passion and her constant work with families and her availability, she will, as far as give her own cell phone out and will be available at any time, I think, and that is powerful for families, because crises don't happen between 9 and 5. They happen on the weekends, they happen at midnight, and I've seen LuAnn be available during those hours. She is, like you said, untiring.
And she's been willing to share her story, to give hope to other families, share her story, to make changes that need to be made in policies and procedures and services.
LuAnn's drive is to help family members and youth have a more effective voice, and to make sure families and caregivers understand how to participate in their child's individualized planning process.
I also work with mental health agencies and other child-serving agencies to better understand how to involve families in work groups, because we tend to bring our emotions and our experiences, and that's why we're there. But sometimes when you're in a work group that's looking at overall policy, our emotions get in the way of the group doing work. And so I think when you have someone that can help you understand, not tell you to get over it and forget what's driving those passions and those emotions, but to say, acknowledge it and say, but can you put it in another place in your mind for a little while?
You get so busy with developing the policies, and that's where your focus is. And that's why having LuAnn present in the meetings, she brings us back to, okay, what's the reality here? What are we all gathered here for? It's really for that child and that family, and improving services for them and their lives overall.
LuAnn has experienced many successes in her life, but she never forgets who helped her along the way through the tough times to reach those moments of glory.
And I really attribute most of my success, and the success that it's led for Spencer, to peer support that I've gotten from people like Barb.
And she's very determined, and she doesn't stop till she finds the resource or the answers to make something happen and work.
I just want to recognize Pam Marshall for the support that she's given me to help me grow as a leader. and I couldn't do it without her, and that I really appreciate her continuing to be available to me when I need an ear and I need some maybe consultation or just in general some support. I'd also like to thank my family who have been there for me and Spencer through the years. Is they have been able to have unconditional support for us, been there. A lot of times when I'm struggling, they're the ones that say, you know, encourage me to take care of myself, but they've also been through some rough times when Spencer was really struggling, and they never made me feel like we had to isolate from them. We were always a part of the family.
LuAnn's hope, her undying hope. Every day she's coming to work, and she's got her own challenges, you know, in her life and with her son, but she comes every day ready to go to work, and like I said, just that undying hope that she has. It gives me hope, it gives people around her hope. So she's good to have in meetings because she keeps the momentum going.
This is what makes LuAnn Reese a mental health champion.